My name is Rachel Stuffer, and this is my presentation. The case study that I chose to do my presentation on was case 17.1 in our chapters in our reading this week, and that was of Della Corbin, who is 72 years old, Caucasian, and recently widowed. So prior to my visit with Mrs. Corbin, I didn't know much about her situation, but after observing it, I was kind of surprised to see how chaotic it was. And so in light of that, I would like to talk to whoever it was that brought her into the hospital. I know that she's connected close with her church community, it sounds like, so I would want to kind of keep tabs on her community there to see if they've been noticing anything strange or changes in her behavior. And I would also want to talk more with her doctor and understand more why he is exploring the possibility of lead poisoning and what he thinks might be causing that. And of course, then I would want to speak with her kids, even though they have been, they live across state or out of state. I would be interested in communicating with them about their prognosis of how their mom has been. As I look back on the interview, there are a few things that I would have wanted to do differently. I think I would have wanted to speak with her doctor beforehand to get a more clear idea about her assessment. I, going in, didn't know much information. It was rather vague. I just knew more about her situation leading up to it and a little about what her current condition was. So I would want to go back and have an idea of what the doctor's assessment was beforehand. Yeah, because the information that I received seems simplified. And I also would have wanted to go back and make sure that I didn't startle the nursing assistant. She's already in a really stressful environment, which I didn't know until observing the environment, but I would have wanted to make sure, yeah, just professionally and socially that she knew I was present and that didn't startle her in any way. So the diagnosis that I would rule out after observing Mrs. Corbin would be dementia and Alzheimer's. I actually don't see her symptoms of aggression and almost violence as related to that, although it could be. It just seems that there was more playing into it, and her symptoms seem to be more hyperactive, meaning she was more physical and just moving around a lot more. And it seemed to be brought on suddenly, which made me think that her condition was even possibly is short-term, so it would be acute. But because of seeing her behavior and her spitting at me and the nurse and baring her teeth, it made me think that her situation had been kind of triggered by being hospitalized. And again, I'm not quite sure why she was initially hospitalized, so I would like to go back and gather more details about that. But she does seem to be experiencing what I would consider delirium. So just as a preliminary diagnosis, based off of my brief interaction with her, I would estimate that her, what she's encountering is acute hyperactive delirium. Again, acute because it was brought on suddenly and short, and hyperactive because of how physical and aggressive she is. And I think this is probably due to another medical condition, in this case, potentially lead poisoning, or other multiple things as well. I'm also somewhat curious what her eating habits have looked like recently, as I observed her being really frail. So yeah, there's just a few more details I would want before making an official diagnosis. But if I were to just on the spot diagnose her, I would diagnose her with delirium for sure. In addition to the physical symptoms I saw her displaying and the aggression and the violence, there's quite a few personal and cultural and psychosocial symptoms and things to consider in her case. As I said earlier, we know more about her situation beforehand, and her husband recently passed away. And friends stated that she started experiencing recent health issues that weren't brought up until she started living alone in a new apartment post her husband's death. And also something to consider, her kids live not close by. And so that's definitely something that could be shaping her well being as well. Well, thank you for listening to my presentation on Mrs. Corbin and my diagnosis on her.